Hi everybody, welcome to Ask Dr. Aviva, your source for natural parenting information. This week we're going to start with a two-part series. Today we're going to talk about preventing ear infections in your children, and next time we're going to talk about treating ear infections when they occur. Preventing ear infections is really important because aside from ensuring that your child has optimal immunity, we're also preventing unnecessary antibiotic exposure. And shockingly, half of all antibiotics given for kids with ear infections are entirely unnecessary and expose our kids to both short-term risks of antibiotics as well as long-term risks, including asthma and development of inflammatory bowel disease like ulcerative colitis and Crohn's disease. So how do you prevent ear infections? It's actually surprisingly simple, and mostly it comes down to breastfeeding your child, because breastfed babies have half the rate of ear infections as bottle-fed children. Avoiding exposure to smoke, both tobacco smoke directly and on caregivers' clothing, as well as smoke from wood stoves, believe it or not, in the home, increases risk of ear infections in kids. Providing optimal nutrition through the diet, including high-quality proteins at every meal, good quality fats, supplementing with essential fatty acids, making sure your kids are getting adequate supplies of fresh vegetables, especially the yellow and orange vegetables like squash and sweet potatoes, which provide vitamin A that strengthens the immune system, and leafy green vegetables like kale and collards and broccoli. Now, I'm a mom too, so I know that getting kids to eat foods can be challenging, but working with them to develop good habits is incredibly important for lifelong immunity and health. And then also making sure they're getting good quality fruits in their diet, nuts and seeds, and absolutely no juice, no soda, processed foods, and believe it or not, even milk. Now, milk and juice actually increase the risk of infection by both increasing mucus production and depressing the immune system. Now, if you have a little one who still drinks milk because they're between 1 and 2 and your pediatrician put them on whole milk, and they have a tendency to get ear infections, talk with your child's doctor about alternatives. But keep in mind that soy milk and almond milk and other sweetened milk alternatives often have just as much sugar and do just as much immune system damage as juice and even soda and milk. So those are not great alternatives. Water is actually the most important beverage for your kids. Certain supplements can actually help boost the immune system and reduce ear infection risk. For example, zinc and vitamin D, which should be given in age-appropriate doses, both to prevent infection and at the onset of any upper respiratory infections. Speaking of the onset of upper respiratory infections, one of the most important ways to prevent ear infections is to prevent colds from turning into ear infections. Now, if you've got kids who've had an ear infection, you know that most of the time they start with a runny nose first. So at the first sign of a cold, make sure you remove any kind of things that can trigger infection from their diet. So for example, milk, juice, wheat, and other dairy products. And then start to add in a few helpful herbal supplements that are child-friendly. For example, elderberry echinacea syrup, garlic lemon honey tea, and if your child is under 1, you can't give honey, so you can use maple syrup. And again, making sure they're getting zinc and vitamin D at the start of infection. All this information and recipes are listed for you in the resources and blog below this video. All of these recommendations not only help prevent ear infections in your child, but promote a foundation of lifelong wellness. Please join me for part 2 next week when we talk about treatment of ear infections using natural remedies.